Pound for pound, no show has brought more potential future technology to the forefront of the public consciousness than Star Trek has in its position as the greatest science fiction show ever. Don't disagree with me. Now look, we talked a lot about different types of Star Trek technology, but this time we'll be taking our first look at a piece of medical technology. That is, if this video is released in the order they were recorded, which totally doesn't always happen. So hey! So today we're going to be taking a look at dermal regenerators. It's a handy piece of first aid equipment that's so simple that a child could use, and it's something which NASA, in collaboration with Houston-based G-Rock Technologies, already has a patent on. So will dermal regenerators soon be gracing the corridors of the International Space Station, or will this join, 97% of other patents that never recoup the cost of filing the paperwork? What is a dermal regenerator? Look, if you either aren't a fan of Star Trek for some stupid reason, or you simply can't keep track of the myriad of different fictional devices that the show employs, you might be asking yourself, well, what exactly is a dermal regenerator, Simon? What is this wizardry? The device itself is extremely simple. It's essentially a magic wand that you can wave over a wound and make it disappear. Despite the fact that Star Trek is notoriously filled with a meaningless technobabble to try and explain away how their machines work, there's generally very little explanation beyond this for how a dermal regenerator actually operates. It looks so simple and straightforward that they may have felt the viewers wouldn't even need to have it explained to them. The device, which really does kind of look like a magic wand when it's turned on, emits a concentrated beam of beneficial radiation that stimulates cell growth and seems to close wounds instantly. They require no training and are common items in every Federation household. Dermal regenerators are able to heal wounds and even second-degree burns instantly, but they do have their limitations. Because they're just mainly regenerating skin, they only work on superficial cuts. Something like scrapes from falling down or some scratches on your android co-worker's pet cat. In the event that you're regenerating wounds from a feline attack, you'll probably want to clean and disinfect the wound first. No mentions of it that we can find are ever made within the Star Trek universe. As the dermal regenerators are simply emitting light and radiation, it's unlikely that they possess any disinfectant properties. You could try to argue that maybe this so-called beneficial radiation both kills unwanted infections and stimulates human cell growth, but one person can only suspend their disbelief so much. In the Star Trek timeline, dermal regenerators are one of the later inventions, not coming into existence until the 24th century. They were the successor to two other medical devices, both of which seemed like superior technology, but they don't look as cool on film. The first was the autosuture, developed in the 22nd century. The autosuture would close and seal wounds, and it was capable of treating much deeper injuries. This is actually similar to devices that already exist, and the prop autosuture heavily resembles the contemporary tools. It was almost certainly inspired by real-world medical technology, but in the show they just explained that in the future they're going to be a lot better. Next came the protoplaser. The protoplaser looked very similar to a dermal regenerator, but it was used to repair veins or arteries that had been severed by a deep wound. These devices were supposed to be invented about 100 years after the autosuture. It's unclear why the dermal regenerator, the device that seems least capable of dealing with severe injuries, was the last one invented in the Star Trek timeline. It could be that other technology was deemed far more important and thus more R&D was spent making them a reality. It's also possible that the effects of the autosuture and the protoplaser could be conveyed entirely through exposition, whereas video editing wasn't advanced enough to demonstrate the dermal regenerator in real time until Star Trek The Next Generation aired. But, as we always ask on this channel, is something like the dermal regenerator possible in the real world, and just how far away is it? The first answer is yes, it is absolutely possible. Love that. While it's unlikely we'll discover some benevolent form of radiation that encourages wound healing rather than, slowing the process and making you terribly sick, an equally simplistic device that heals wounds just as quickly is certainly possible. Currently, lasers can be used to seal superficial wounds exactly like the dermal regenerator. The process is a little slower, but it is still extremely quick. The main differences are that this would still require some training, and it does not currently exist in a portable handheld form. But lasers are just one of the many ways that people are trying to replicate the effects of the dermal regenerator, and that brings us to NASA's patents. Bioreplicate. Bioreplicate is the name of the device being developed by G-Rock for NASA. Rather than using lasers or radiation to close wounds, the purpose of the device is to create 3D human tissue models. It's essentially a 3D printer for human samples. The main purpose of of the device was for use in testing drugs and cosmetics. By creating 3D models of human tissue, G-Rock believed they could improve the quality and safety of testing these products. NASA is also hopeful that the device could help reduce animal testing or even eliminate it entirely. This is great not only for the animals that would otherwise be tested on, but also for humans as well. Drug trials can take an extremely long time before they begin to approach the human testing phase. By skipping all of the animal testing and going straight to tests on lab-grown human tissue, potentially life-saving drugs could reach full-scale human testing much faster. NASA also recognized that this technology could be used for wound healing, and they are excited about the possibility of using bioreplicate on the ISS as a means for astronauts to easily treat any minor wounds they might suffer without the need for medical intervention. This is particularly appealing as the ISS doesn't always have a physician on board. The details of how such a device would work weren't made clear, but presumably they would just use bioreplicate to 3D print skin samples and seal the wounds. But bioreplicate is just one of 2 patents that were filed jointly by NASA and G-Rock Technologies. The other is called Psionic, then this is a form of pain management. Psionic treats pain and inflammation essentially by stimulating the body's natural ability to produce painkillers. The Russian Federal Space Agency already utilizes a technology similar to Psionic. It is believed that if successful, bioreplicate and Psionic could be used in tandem to immediately seal and provide pain relief for minor injuries. It will be like those cuts and scrapes never happened at all, at least as long as it is successful. The partnership and patent filings were announced in 2014, but since then, everything's been rather silent. G-Rock's website promises that their product produces the highest quality 3D human tissue models on the market. The same website is also promoting an upcoming event for investors in October of 2019. Seeing as this means that they haven't updated their site in over 3 years, that's not a great sign for how things are going at the company. Whether this patent pans out and NASA gets its shiny new technology, that remains to be seen, but the outlook doesn't exactly look brilliant. Even so, they aren't the only ones trying to bring dermal regenerators to the market. Mobile skin bioprinter. One promising attempt at a dermal regenerator is being developed by the Wake Forest Institute for Regenerative Medicine, part of the School of Medicine at Wake Forest University. The device is called the Mobile Skin Bioprinter, and it delivers everything the name promises. It is a 3D printer for skin, and the entire apparatus is bolted to a wacky rack, making it technically mobile. The machine was developed in 2018, and initial tests on animals produced extremely promising results. Had G-Rock been more successful with their bioreplicate, then that animal testing might have not been necessary, but here we are. The process is a bit more involved than just waving a magic wand like Star Trek portrayed, but it's still pretty cool. Imagine you go to urgent care because you got a cut that you suspect needs stitches or at least to be glued. Instead, they wheel the mobile skin bioprinter next to your bed and just get to work. They begin by taking a small biopsy of healthy skin tissue from your body. The skin cells are then placed in a container where they can be easily isolated and expanded. They are then mixed with a hydrogel and placed into a bioprinter. While this is taking place, the wound is scanned with lasers so that they can see every contour of the wound. A robot arm then begins printing the skin cells exactly where they're needed to best seal the wound. They're also printed in multiple layers, replicating your own skin. Like we said, it is a bit more involved. However, not only is this technology extremely promising, but it has some serious advantages over traditional methods. The mobile skin bioprinter could be utilized in cases of larger wounds or severe burns where skin grafts would otherwise be necessary. One issue with skin grafts is that there's often not enough healthy skin from the injured person remaining. When this happens, a donor graft may take place. Unfortunately, these often result in the body rejecting the donor skin the same way that it might reject any other organ. With the bioprinter, it is the person's own skin cells being used. That means you'll have no fear of rejection, unlike the fear of rejection from those around you that you might feel while going on a 12-minute monologue about future technology from Star Trek. Instead, the bioprinted skin will grow new, healthy skin from the center of the wound. This technology is still in the experimental phase, but it's showing a lot of promise. The wounds this is intended to treat are generally much larger in scale than the capabilities of a dermal regenerator, but it's likely that the technology could be refined and scaled down if it is successful. It's not hard to conceive of a handheld device resembling a dermal regenerator that utilizes the technology for small wounds requiring only a pinprick from the patient to acquire the necessary skin cells for bioprinting. wrap up. It seems almost impossible that we won't see technology resembling the dermal regenerator within our lifetime. While we only covered 2 different potential methods in depth today, it's important to remember that there are innumerable teams working towards this goal by employing a wide range of different methods. We briefly touched upon lasers as another means to seal wounds, but in the last few years alone, there have been studies published using some pretty innovative strategies. One study employed the use of silkworms and spiders to seal wounds. Another used photosynthetic microalgae to accelerate wound healing, as well as fighting off infectious bacteria. Yet another discovered, quite by accident, is that flipping the orientation of proteins in a hydrogel scaffold could activate the body's natural immune system to trigger accelerated wound healing. The latter 2 examples don't promise instantaneous healing, but any improvement is a step in the right direction. There's also an entire branch of medicine known as photomedicine that more closely resembles the ideas conjured in our imagination by dermal regenerators. While these processes don't result in the seemingly magical closing of wounds, there are a lot of scientific reports that demonstrate the use of low-powered lasers in accelerating wound healing time and reducing scarring. It's possible to guess at this stage which technology the real-world dermal regenerator is going to employ. However, we are fully confident that these will become a reality well before the 24th century, as predicted by Star Trek.